Welcome back to the Deep Dives, where we take your stack of sources and distill them into insights you can actually use.
Glad to be here.
Today, we're plunging into a topic that, well, it touches almost all of us in this digital era. How we truly engage with online tools designed to improve our health.
Right. Those apps and websites promising to help us change our behavior.
Exactly. We're dissecting a fascinating viewpoint paper from the Journal of Medical Internet Research. It's titled, Measuring Engagement in eHealth and mHealth Behavior Change Interventions. Viewpoint of Methodologies.
A bit of a mouthful, but a really important topic.
So think about it. Maybe you've downloaded a fitness app or tried a mindfulness program, perhaps used a dietary tracker on your phone or computer.
Things many of us have tried, yeah.
These eHealth and mHealth interventions, they promise accessible, low-cost support for behavior change.
That's the appeal.
But there's this persistent question mark hovering over their long-term effectiveness.
Yeah.
Why do so many people drop off?
Why do those adherence rates often plummet after that first initial surge of enthusiasm?
It all boils down to a word we toss around a lot. But what does it actually mean in this specific, crucial context? Engagement.
And what's really striking about this paper is how it immediately zeroes in on this core challenge. We all sort of instinctively agree that engagement is vital for these digital health tools to work, right?
Sure, it seems obvious.
Yet for years, there's been a surprising lack of consensus on what engagement is and, maybe more importantly, how do we measure it reliably?
Is it simply about logging in every day, or is there like a much deeper, more nuanced process happening?
That's the puzzle. And our mission today is really to cut through some of that confusion, explore the, well, sometimes quite ingenious ways researchers are trying to capture this elusive concept.
And ultimately what that means for you and the digital health tools you might encounter, maybe even use every day.
Exactly. Unpacking the definitions, looking at the measurement techniques.
Right. Okay, let's unpack this.
Let's do it.
So before we even think about measuring engagement, we need to grapple with what it truly means in this whole eHealth and mHealth world. Because as this paper quickly makes clear, it's really not as straightforward as it seems. We often assume engagement just equals usage, don't we? Like how often you open the app.
It's a very common trap, yes. The research shows that engagement is frequently confused with adherence, which is simply, following the instructions, using it as the developers intended.
Okay, so just doing what you're told.
Pretty much. But that's only one slice of a much richer pie. Historically, different scientific fields have approached this concept from, well, wildly different angles.
How so?
Well, behavioral scientists might link good engagement to, say, high acceptability or satisfaction with a program. Do people like it? Do they find it useful?
Makes sense.
Computer scientists, though, they tend to view it more as a mental state, that feeling of increased attention, maybe absorption, even enjoyment while you're using the tool.
Okay. So we're dealing with this kind of split. Is it a psychological experience inside your head, or is it purely a behavioral one, something we can see?
Precisely. And the paper highlights two key conceptual models, one by Yardley and colleagues, and another by Persky and colleagues, that really help to bridge this gap. They try to consolidate these viewpoints into something more comprehensive.
Let's take Yardley's model first. It distinguishes between, micro and macro level engagement. Can you walk us through those?
Sure. Think of micro-level engagement as the moment-to-moment interaction you have with the intervention.
Like right when you're using the app.
Exactly. It's about how you use it, the number of activities you complete, maybe your time spent, but it's also your user experience, that immediate feeling of interest and attention as you're interacting.
Okay, so the immediate stuff. And then macro-level engagement takes us deeper.
Precisely. Macro-level engagement is about your depth of involvement with the actual behavior change process itself.
So less about the app, more about the health goal.
Yes. It's your underlying motivation to change, how much you're really thinking about the health information, or your internal commitment to sticking with new habits.
Right.
And here's where Yardley's model offers a truly counterintuitive yet really powerful insight.
Oh.
It suggests you might actually disengage from the app itself.
Stop using it.
Yeah, stop using it maybe daily, but still be deeply involved in the behavior change process.
How does that work?
Well, you might stop needing the app every day because you've successfully internalized its lessons. You're sticking to your new healthy habits without needing that digital prompt anymore.
Wow, that's fascinating. Because it means just tracking app usage might completely miss the real success story.
Absolutely. It highlights the limitations of just looking at logins.
So Persky et al.'s framework offers a similar but maybe even more refined view. They also define engagement as both the extent of usage and a subjective experience.
Indeed. They refine that subjective experience part to specifically include attention, interest, and affect your emotions or feelings while using it. And they draw on concepts from computer science that many of us might intuitively understand, things like flow.
That feeling when you're totally absorbed.
Exactly, where time seems to vanish. Or immersion, feeling completely enveloped by the digital experience and presence, that sense of really being there within the virtual environment.
Right, like in a really good game.
Kind of, yeah. All of these relate to a profound level of absorption and preoccupation with the tool.
So what's key here then is that both these models agree. Simply measuring how much you use an intervention. Well, it might be an indicator, sure, but it's definitely not the whole story of engagement, especially not engagement in the behavior change process itself.
That's the critical takeaway. It's that complex interaction between your visible usage and those subtle internal psychological processes that really matters.
The profound insight isn't just that engagement is complex. It's that we must look beyond those surface-level app use metrics to genuinely understand if behavior change is happening.
Couldn't agree more. If we connect this to the bigger picture, these models are absolutely vital. They give us a more refined lens to examine how specific features in an app or even external factors in your environment influence your engagement.
And then how that engagement, the real kind, influences your health behaviors.
Exactly. But as the paper really stresses, to truly test these more sophisticated hypotheses, we need equally sophisticated ways to measure this multifaceted concept. We can't just rely on counting clicks anymore.
Okay, so we've established engagement is far more than just clicks. It's this whole multi-layered psychological and behavioral dance. But if it's that complex, how on earth do researchers actually, well, capture it?
That's the million-dollar question, isn't it?
It seems like it. This paper opens up what you called a truly ingenious engagement toolbox, revealing, I think, 7 diverse approaches, each designed to peel back a different layer of this elusive concept.
That's right. 7 main categories of methods.
Let's dig into some of these. What's first?
First up, let's talk about qualitative methods. When we talk about these, we're really trying to dig for the why and how through rich, descriptive data, not just numbers.
Okay, like talking to people.
Exactly. This includes things like interviews, which can be semi-structured, maybe more open-ended focus groups for capturing group dynamics and shared experiences.
Right.
And also think aloud activities. That's where users verbalize their thoughts and feelings in real time as they're actually interacting with an app.
Oh, interesting. So these methods are really about getting inside the user's head, right? They seem invaluable for capturing that rich, nuanced user experience and that depth of involvement we talked about.
Precisely. They directly address both micro and macro level engagement. They provide these really in-depth accounts of user experience. They can reveal perceptions users might not even realize they have, and they're fantastic for generating new hypotheses about what truly drives engagement.
You get quotes like, "I felt frustrated when," or "This part really helped me reflect."
Exactly. Those insights are gold. The challenge, though, the downside, is that results can be hard to compare across different studies.
Less standardized.
And they often aren't generalizable because you usually work with smaller sample sizes. Plus, the analysis is incredibly time-consuming. Ideally needs more than one person to code it reliably.
Okay, so powerful, but maybe not practical for every situation.
True, though the paper mentions machine learning might help automate some coding in the future, which is promising.
While qualitative methods give us those incredibly rich personal stories, what if we need to quickly gauge broader sentiment or track changes across a large group? That brings us to self-report questionnaires, right?
Correct. A very familiar tool for most people involved in research.
They seem straightforward, but the paper suggests they come with their own set of critical nuances.
They do. These are essentially structured surveys designed to assess both the experiential and behavioral aspects of micro-level engagement and sometimes even changes in psychological mechanisms like motivation for macro-level engagement.
So you can ask about feelings and track deeper changes.
Yeah. They're often used to capture that subjective experience, asking about interest, attention, emotions. They've also been used to estimate usage when you don't have objective data, like asking how many times per week did you use the app.
Right. relying on memory.
And crucially, they can track shifts in psychological factors like self-efficacy, helping researchers see if the intervention is working at that deeper internal level.
The big appeal, I guess, is they're systematic, standardized. Makes comparing results easier.
That's the main advantage. They're convenient and allow for easy comparison across studies.
But there's always a catch, isn't there? What are the cons here?
Absolutely. A big one is that many existing scales weren't specifically developed or validated for the unique context of eHealth interventions.
So they might not be asking the right questions.
Potentially. Or they might be too long, which causes user fatigue. People just stop answering carefully. And occasionally, some scales actually confuse engagement with its predictors, like how easy the app is to use, which is usability, not engagement itself.
Measuring the wrong thing.
And that self-reported usage, it can be pretty inaccurate. People tend to over or under-report their behavior.
So what was the recommendation?
The paper strongly advocates for developing and validating short eHealth-specific questionnaires, and crucially, using them to complement objective usage data, not as a replacement.
Okay, makes sense. Moving beyond looking back, we have ecological momentary assessments, or EMAs. These sound like they're about catching engagement as it happens.
Exactly. In the real world, in the moment, EMAs are brief, real-time self-reports, often delivered directly via smartphones or wearables.
Like a little pop-up survey?
Sort of, yeah. They can be triggered in different ways, maybe on demand by the users and at specific times or random intervals, or even triggered by an event detected by the phone or wearable.
Like asking how you feel right after your activity tracker shows you've been active.
Precisely. They are perfect for capturing that moment-to-moment micro-level engagement. And they can provide really valuable data-driven insights into exactly why someone might be disengaging or dropping out at a particular time or in a specific context.
And that real-time aspect, it must drastically reduce the recall bias you get with questionnaires. Gives a more accurate picture.
Huge advantage. Much higher ecological validity because they capture experiences in natural settings as they happen.
But what are the challenges?
Well, the surveys must be incredibly brief. You can't ask too much or people will just ignore them. User burden is a big factor.
Right, you don't want to know people.
And the data they generate, intensive longitudinal data, can be quite complex and challenging to analyze, especially for researchers maybe not used to those specific statistical techniques.
Okay, now let's tackle the big one. System usage data. This is probably the most common form of measurement, what most developers track, right? Clicks, time spent.
Absolutely the most common. But this is also where the paper issues a really significant warning.
Okay, tell me more. So it quantitatively captures how you physically interact with an intervention, clicks, time on site, actions taken.
Yes. And the paper suggests a useful way to categorize this data, borrowing the SAT acronym from physical activity research.
FITT. What does that stand for here?
Frequency, how often you log in or visit. Intensity, how deeply you engage, maybe the percentage of features used or the number of posts written in a forum.
Okay.
Time, duration of engagement, either per visit or summed up over the intervention period. And type, what kind of engagement are we seeing? Is it reflective, like self-reporting symptoms? Is it gamified, like completing challenges? Altruistic, helping others? Or didactic, just reading content?
That FITT framework seems like a helpful way to organize all that data.
It is. It provides structure.
So it gives us a pretty granular view of interaction. The pros are obvious.
Yeah.
It's easily collected, especially with good planning, and it's unobtrusive for the user.
Right. And it can certainly provide some information about what parts of an intervention might be more engaging than others.
But here comes the warning you mentioned.
Here it comes. While valuable, the paper emphasizes quite strongly that system usage data alone is not a valid measure of micro or macro engagement.
Wow. Okay. Why not?
Because it doesn't directly tell you anything about the user's psychological experience, their attention, interest, affect, or their true involvement in the behavior change process.
So lots of clicks doesn't necessarily mean deep engagement.
Not at all. Plus, good tracking generates vast amounts of data that can be incredibly hard to interpret without a clear, predefined analysis plan. You can get lost in the numbers.
Yeah, data overload.
And there are technical confounders too, like someone having multiple tabs open or shared IP addresses in a household or using VPNs, all things that can obscure the true usage picture.
So it tells you what happened on the screen, but not necessarily why or what it meant to the user's journey.
Precisely. It's a piece of the puzzle, but definitely not the whole picture.
Okay, that's a really important caution.
Yeah.
What if we want to look beyond the screen entirely? Method 5 is sensor data. This sounds like it moves beyond direct app interaction.
It does. It taps into your physical world. This involves using sensors like GPS, accelerometers, maybe even cameras for eye tracking later on, often embedded right in smartphones or wearables.
So using the phone's own capabilities.
Exactly. The beauty here is it can unobtrusively monitor your behavior and your physical context, providing direct behavioral data relevant to both micro and macro level engagement.
Give me an example.
Okay, so accelerometers can track your physical activity. This gives insights into whether low app adherence means someone's disengaged, or perhaps they've actually achieved their activity goal and don't need the app as much anymore.
Ah, like the Yardley model suggested.
Just like that.
Ah.
Or GPS can show where you use an app. Say, if a healthy food app is used at home or in grocery stores, but maybe never in restaurants, that adds crucial context to your offline engagement with the intervention's goals.
And these sensors can even trigger those EMAs we talked about.
Yes, providing context-aware prompts.
So it really enriches the picture of real-life usage without constantly needing input from the user.
That's the big plus. It's unobtrusive, generally low user burden, scalable to many users, and provides incredibly rich context.
But there must be downsides. Privacy seems like a big one with GPS.
Huge issue. Privacy concerns are significant and need careful ethical handling. Also, GPS data analysis itself can be quite time-intensive.
And battery drain.
Definitely. Running these sensors constantly can really impact phone battery life, which, ironically, can affect user compliance with the study itself.
Right. People might just turn it off. Okay, next up, method 6, social media data. This sounds like a really modern approach.
It is a fascinating emerging area. It involves analyzing social media patterns, posts, comments, shares to try and gauge user experience at the micro level and maybe even behavioral achievements at the macro level.
How would that work?
Researchers might look at, say, the number of wall posts mentioning an intervention in a physical activity group. Or there's a really clever technique mentioned in the paper using markers.
Markers.
Yeah, unique, essentially non-existing words that are launched exclusively with the intervention. The paper gives the example falterhead for a video intervention about cognitive problems.
So a made-up word.
Exactly. This allows researchers to easily search social media and quickly identify all the public content related to that specific program, filtering out irrelevant noise.
That's brilliant. And you can analyze this data both quantitatively, like how often it's discussed, patterns over time, and qualitatively.
Yes, looking at the sentiment, are people positive or negative? What topics are they discussing related to the intervention?
You could even identify different user types.
Indeed. The paper mentions profiles ranging from lurkers, who are just passive consumers, to casuals, actives, committed, and even loyalists, which could be strong indicators of increasing levels of engagement.
The pros seem clear. Unobtrusive, low user burden for the participant. And it can reveal this kind of social spread and real-life engagement that happens totally outside the app itself.
True. The biggest challenge, though, is just the sheer volume and noise of social media content. Extracting the truly relevant information requires specialized tools and often a complex combination of qualitative and quantitative analysis skills. It's not easy.
All right, finding the signal in the noise. Okay, that brings us to the final category, number 7. Psychophysiological measures. This sounds intense.
It definitely gets closer to the biological source. This category dives into your internal physiological responses. It offers potentially the most direct way to measure those experiential aspects of micro-level engagement we talked about earlier: attention, emotion.
I'll give you that.
These methods examine the relationship between your physiology, your body's responses, and your behavior or cognitive processes during interaction. They offer really strong temporal resolution, meaning they can pinpoint precisely when and how your brain or body reacts to different elements of an app, moment by moment.
Wow. What are the key methods?
Well, a major one is EEG, or electroencephalography. That involves recording electrical activity in your brain using electrodes placed on the scalp.
Okay, I've seen pictures of those caps with wires.
Exactly. Researchers look at specific patterns called event-related potentials, ERPs. These are tiny changes in brain waves that happen in direct response to specific stimuli, like something appearing on the screen.
And what can that tell you about engagement?
For instance, certain ERP components can reliably index something called attentional reserve, basically, showing if you're truly paying attention and have cognitive resources available for a task, like playing a game within the app.
So it's not just about what you click, but what your brain is actually doing in response to it.
Precisely. Another key method is eye tracking. This is based on the very strong link between where our eyes are looking and what we're paying attention to.
Makes sense.
So data on fixations, where you pause your gaze, how long you look at something, your overall scanning patterns, this can show how your attention shifts over time. It can even reveal if certain parts of a website attract your attention initially, but don't necessarily lead to deeper clicking or interaction.
Interesting. Catching attention isn't the same as keeping it.
Exactly. And the paper also briefly touches on other methods like electrodermal activity or EDA, which measures changes in skin conductance.
Like a lie detector test.
Sort of related, yeah. It reflects physiological arousal, which is linked to emotional response. And electromyography, EMG, which can detect tiny, often involuntary muscle movements like facial muscles associated with frowning or smiling.
So you could potentially measure subconscious emotional reactions.
That's the idea. These provide direct, objective physiological markers of cognitive and affective states, offering really precise insights into that moment-to-moment experience.
That's incredible potential.
Uh-huh.
But it sounds like these aren't exactly subtle methods to use. Probably not something you do on your phone at home.
You're absolutely right. These methods are generally much more obtrusive. They're often used in controlled lab settings, not out in the wild.
Right.
And they require significant expertise, not just for the measurement itself, but also for the complex analysis of the data generated.
Is attention or arousal the same as full engagement?
That's a crucial point the paper makes. Capturing attention or arousal is really just the very first step, the initial appraisal, in the much broader process of engagement. It doesn't capture the whole picture.
Okay.
And interestingly, the paper points out that the association between these objective physiological measures and people's own self-reported feelings of engagement isn't always straightforward. Sometimes they align, sometimes they don't.
Which just highlights again how complex this whole concept of engagement really is.
It really does. It's not one single thing.
Wow, that's an extraordinary array of tools. From, simply asking someone what they think, all the way to tracking their brainwaves and eye movements. It truly shows just how multifaceted this idea of engagement is, far, far beyond just opening an app.
Absolutely. And the paper really emphasizes that while these methods are incredibly diverse, the best approach isn't a one-size-fits-all solution. It really depends on the specific research question, the stage of the research, the context.
Right.
But there's a very strong consensus emerging, and the paper highlights this. Using multiple methods and triangulating the data is crucial. You need to combine different perspectives.
So bringing different pieces of evidence together.
Exactly. Relying solely on that system usage data, which, as we said, most studies currently do, well, it simply isn't enough. It doesn't capture the full, rich picture of either micro or macro level engagement.
So just to make sure I'm getting this right,
Yeah.
what you're saying is that a lot of what we think we know about the effectiveness of digital health tools may be based purely on things like app downloads or time spent in the app.
Yeah.
That might be missing the real story.
That's a very real possibility, yes.
Missing whether someone is genuinely connecting with it and changing their behavior in a meaningful way.
Precisely. We absolutely need to assess the psychological aspects of engagement, those internal shifts in motivation, attention, emotion, understanding alongside the behavioral data, the usage data.
To see how they interact.
Yes, to truly understand that interplay between perceptions, usage, and ultimately whether the intervention is actually effective in changing health outcomes.
And that sounds like it requires more teamwork between different fields.
Definitely. The paper calls for more interdisciplinary collaboration, bringing together expertise from informatics, computer science, human-computer interactions, psychology, behavioral science.
Pulling all that knowledge together.
It's clear that building this comprehensive picture requires a blend of approaches, not just searching for one single perfect measure. That probably doesn't exist.
That really shifts the entire perspective, doesn't it? It feels like we're just scratching the surface of truly understanding how these digital tools can empower us to make healthy changes. And crucially, how to design them for true, lasting impact, not just initial clicks.
I think that's a great way to put it. There's still a lot to learn.
What an incredible deep dive. Really getting into what it means to be truly engaged with these digital health interventions. We've journeyed from those fundamental definitions, explored micro and macro level engagement, to this fascinating exploration of the 7 key ways researchers are trying to measure this incredibly complex human experience.
It's certainly clear, I think, that the future of effective eHealth and mHealth lies not just in designing, slick or appealing interfaces.
Right, not just making them look good.
But in rigorously understanding how users truly connect with these tools. On a behavioral level, yes, but also cognitive and emotional levels, too.
There's work to be done there.
Oh, absolutely. The need to properly validate these diverse measurement methods, figure out the best ways to combine them intelligently, that's a critical next step for the whole field.
So for you, the listener, this raises, I think, a really important question. The next time you interact with a health app or some online program, don't just ask yourself, am I using it enough?
Go beyond the usage metric.
Exactly. Instead, maybe ask, is this tool genuinely shifting my deeper understanding, my internal motivation, my actual habits,
Yeah.
even when I'm not actively tapping the screen?
That's the macro level perspective.
Yeah. The paper really challenges us, maybe, to redefine our personal bar for what counts as success with these digital health tools. It's not just about logging in.
And hopefully it's provoked a few new questions for your own digital journey into well-being, thinking about what really works for you.
Thank you so much for joining us on this deep dive. We really hope it's given you some new insights into the evolving science behind our digital health and how we measure real progress.
Thanks for digging in with us.
Until next time, keep digging, keep learning, and keep engaging with the world around you.